steps. You can find it on the United States Healthcare, Human and Resource Healthcare website, and they have what is called a readiness assessment. Actually, that's what the nurse leader uses to see, is my team ready for such a training? Can I implement this in my work environment? Mainly, this has been recommended, and it has various curriculum materials. They've got rapid response guides, long-term care, even a dental module. But what is good about it is it focuses on leadership, situation monitoring, mutual support, and communication. And another thing about it is it has been proven that it does help improve teamwork and collaboration. The only thing that they had as a limitation is how to implement it in a non-simulated setting. But with our computer systems now, I don't think that would be a real problem. And that is something that we could also use, we could discuss with our education department, and I'm sure that they would be eager to be using something like that, or even using a Lean Belt plan that we can implement. Lean Belt, using leadership skills to implement something that would be efficient and effective for the VA. Also, we had Fall Actions Research Group. Now, you might think, why in the world would I put a Falls Action Research Group here? This was a resource that was used, and the main reason why I've got this here is the study stated you can substitute any type of group project to promote teamwork and collaboration. They had a group of facilities, and their falls were just escalating. And so what they did, they had an action plan, they got a group together, and they were meeting once every 2 weeks. They were getting strategies together, goals together, and they found out something. When they had a common goal, teamwork and collaboration started to improve. So they stated, even though there was some limitation with the sample size and a lack of representation from CNAs, they said you can still implement this with any type of group. So that is something that we can look at too. Finally, the VA has what's known as CREW, and as you have a flyer around here, it is a program that was set up to try to help teamwork and collaboration. Here you go, Sue. It is civility, respect, and engagement in the workplace. Civility being an essential behavior that involves fundamentals of courtesy, respect, an attitude developed from active listening, as I stated, understanding culture and personality, and engagement is the outcome of a respectful relationship. It is a person-centered module. But enough with that. What you might want to ask is, what are the benefits? I had on the second sheet a flyer, and it was talking about how this affects the work environment. Fewer EEO complaints. Fewer sick leave hours. How many of you have had it where you weren't physically sick but mentally sick because you just couldn't take the pressure anymore and you called in? When you have a healthy work environment, it does help you mentally and physically. Higher patient satisfaction, higher employee satisfaction, and intent to stay with the VA. It does have an impact. Now, how do you implement it? The nurse manager, like Natasha or Deanne, would be provided details how to contact the personnel and the process used to implement this. You would have CREW documents, selection of a designee to coordinate the CREW initiative, and a conference call including the facility director, Dr. Ginsberg, labor partners, the CREW coordinator, CREW spokeswoman, and the nurse manager. They would discuss this. And one thing that I noticed that they really hit, they said this is something you have to be persistent about. You don't just get teamwork and collaboration overnight. They stated they usually have this for approximately 6 months. They engage in problem-solving efforts, encouragement of discussions, exercises to promote teamwork. And they want to see how willing the nurse leaders are in regard to implementing crew. I'll put it like this. In a nutshell, it's like when you give patient education and you tell the veteran, this is what your plan of care is. It's how willing he or she is to follow through with that care plan. And that's pretty well what they're saying about crew. It's how willing you are to go on. I know that we time and time again have had this talk to us about teamwork and collaboration, and we have it in settings that we feel like, yes, that would work here, but you don't know what I'm going through. You don't know my work environment. But I want you to know I'm a VA employee just as you are, and I deal with situations over there at the CLC that I know can be either positive or detrimental. And I want all of us to go forward. You know, all of us are, hey, we're good nurses, but we can be that much better if the whole team comes together. So I hope that you have taken into account the things that I've stated. I hope you retain this. One long-term goal I have is that at least 50% of you might be able to retain some of this information. And like I said, check the websites. The United States Health and Human Service. They have things about team steps. The VA website has it about crew. All you have to do is type it on the browser, crew, and believe me, it shows up. There's always ways that we can research things, always ways that we can improve on ourselves. It's just like I was asking before we started filming. I asked how many of you had necessarily went through a higher level of learning and you had to do a presentation. That way you kind of have some empathy for me. But all of us, we can all do something. We can all engage in the goal. I'll close with this. About a week and a half ago was the 49th year anniversary of the assassination of Martin Luther King Jr. And he was a model figure at that time. The city of Indianapolis had Senator Bobby Kennedy over there. And the then mayor, Richard Lugar, asked Bobby, don't tell them Martin Luther had just got assassinated. This would make a very hostile environment. But Bobby said, no, they need to know. He got up and he stated, after they did the cheers, he said, I have some sad news to tell you that Dr. Martin Luther King Jr. has been assassinated, and you could have heard how the crowd was going. He said, but I want you to remember what he said and what he stood for. And he said, by the way, I too had a family member that was shot and killed by a white man. I know how you feel right now. And what was so unique, that was the only city or metropolitan area that was really heavily involved with the civil rights movement that didn't have any hostility because of what Bobby did. So likewise, you might have something that's going to erupt, but with the resources, proper knowledge and engagement, you can reduce that chance of hostility. I appreciate it, thank you. Natasha has a sign-in sheet, and you will notice it will ask you also, was this helpful? And be honest with me, because even though I know this is a school presentation, hey, I want to do better even at work. Thank you.